Hi, my name is Alyssa and I am making this video for PT Final Exam. I am so thankful for all the help that they gave me while I was studying for the exam. I finally passed on my third try and it's all thanks to all of those that helped me. So I feel the need to give back now to help those who are struggling with the exam because I know what they're going through and I want to be there to lend a helping hand for them. So tonight my topic is going to be focusing on Gait. But before we get started, I want to show a couple of textbooks that helped me out while I was studying for the exam. Because Gait was something that I did struggle with. So the first textbook is the Ranchos Los Amigos Observational Gait Analysis textbook. It's very tiny, but it's really thorough, and it can help you out tremendously. Another book that you can never go wrong with is the O'Sullivan textbook. There's a lot of good information on Gait, especially when it really gets tricky is when you've got the abnormal gait pattern. So this does a really good job at covering those as well. So those are just two great textbooks that I would recommend for you all to use while you're studying. So like I said, tonight we're going to talk a little bit about Gait. We're going to start with some objectives though. I feel objectives are super important. They help you focus and kind of hone in on what we're going to be talking about and, again, touching on the topics that are going to help you be successful with this exam. So tonight we're going to cover the definition of Gait. We're going to talk about what exactly is the gait cycle. We know there's a stance phase and a swing phase, but there's so much more that goes into it. So we're going to go over those little subdivisions in each one of those phases. We're also going to talk about different parameters of the gait cycle as well as gait patterns and walking aids. Alright, so gait. The definition of normal gait is it's a series of rhythmical alternating movements of the trunk and limbs which result in forward progression of the center of gravity. Gait is a style, it's a manner or pattern of walking. So you're going to notice as you do different gait analysis on people, and I challenge you to go out to the malls, go to Walmart, go to the grocery store, and when you're there, try and notice something about somebody's gait that is different than the next person's gait, because that's gonna be how you really get good at gait analysis. So you're gonna notice that everybody has different walking patterns, but they're gonna go through those same phases, stance and swing. So none of that's gonna be different, but they're gonna have a little bit different style to each one of those. So it's kind of cool when you get out there and check those out. The gait cycle is defined as the period of time from one heel strike to the next heel strike of the same limb. So like I mentioned earlier, the gait cycle consists of two main phases. Those are the stance and the swing phase. And also to kind of go a little bit more deep, there are two main phases of walking. So we have the non-weight bearing phase, which is no contact. That's called the swing phase. So again, you're going to hear some words tonight that are going to be interchangeably used on a test. So you're going to want to be able to understand and go back and forth between them because the test can use either form. It's all up in the air, so they can use whatever they want. So again, non-weight bearing phase, no contact, or swing phase. This is basically when the weight of the foot is not on the floor. And then we have the weight-bearing phase or contact phase. Again, the weight of the foot is on the floor. So the stance phase begins when the heel of one leg strikes the ground and ends when the toe of the same leg lifts off. This constitutes approximately 60% of the gait cycle. And within the stance phase, we are going to have different subdivisions is what I'd like to call them. So we're going to have the heel contact or initial contact. We're going to have foot flat or loading response, which is the initial contact of the forefoot with the ground. We're going to have mid-stance. Now notice with mid-stance there's no like interchangeable words. It's just going to be mid-stance, so that's an easy one. That is the greater trochanter is in alignment with the vertical bisector of the foot. Then we have heel off or terminal stance, and then we have toe off and pre-swing. Those are all part of the stance phase. Alright, then we have the swing phase. The swing phase represents the period between a toe off of one foot and the heel contact on the same foot. So this constitutes approximately 40% of the gait cycle. So within the swing phase, we have acceleration or initial swing. We have mid-swing, so there's no interchangeable words with mid-swing. And that's when the swinging limb overtakes the limb that's in stance. And then we have deceleration or terminal swing. All right, so now we're going to get into a little bit of our gait terminology, some things that I think are important to know. Some of these kind of tripped me up, so that's why I want to go over them with you. All right, so the first one we're going to talk about is cadence. That's the number of steps per unit time. Usually we're looking at 100 to 115 steps per minute. That's the normal. You'll notice some variation in cultural norms, but for the purpose of the test, that's not really important. So the other thing is speed, or also known as velocity. That's usually written in meters per second. So when you see somebody doing a gait speed test or gait velocity test, you'll always notice that the units are in meters per second. Again, this is the distance covered by the body in the unit of time. All right, then the next two. These are the ones that really tripped me up. Stride length and step length. So we're going to start with stride length. Stride length is the distance between successive points of heel contact on the same foot. Okay, so stride is on the same foot. Step length is the distance between corresponding successive points of heel contact on the opposite foot. So step length is on the opposite foot. All right, so let's get into gait patterns with walking aids. So the first one we're going to talk to you about is swing to gait. So in this gait, both crutches are brought forward together. The trunk and lower extremities lean forward, weight is transferred to the upper limbs and walking aids, and then both lower extremities are lifted and swung forward to the level of the crutches. So your lower extremities will come to, they will meet at the crutches. So that's why it's called swing to. You're swinging to the crutches and no further. The one that you swing past the crutches, that is called swing through gait. So this is when both crutches are taken forward, then both lower extremities are lifted and swung past the crutches or through the crutches, and the crutches are left behind the feet. So that is called swing through gait. Okay? So swing through gait is most commonly used by those with no lower extremity control, such as spinal cord injury patients. It's really unsuitable for those with painful lower extremities just because they're putting a lot of momentum and acceleration behind that swing. So that's something that you want to be mindful about when you're in the clinic. Okay, the next one I'm going to talk about is a two-point gait pattern. In the clinic, for the most part, you're going to see a contralateral two-point gait pattern. Some clinicians still use the ipsilateral gait pattern, ipsilateral two-point gait pattern, but for the purpose of the exam, most of the time you're going to want to hold your assistive device in the opposite extremity or contralateral extremity. So this is when the contralateral hand and stick, so this would be technically a cane, it could be a crutch, are moved together with the affected leg. So again, I'm going to say that again. The contralateral hand and stick, so it could be a cane or a crutch, are moved together with the affected leg. So the weight is shared by both of those, and the affected side, as the non-affected leg, is brought through. All right, the next one we're going to talk about is the three-point gait pattern. This requires two walking aids. So if you ever see a question on the exam about three-point gait pattern, make sure that they have two walking aids. Again, this could be either crutches or canes, followed by the affected leg and then the unaffected leg. So it would be the assisted device, the affected leg, and then the unaffected leg. Okay. In regards to three-point gait pattern, if a minimal weight-bearing gait is required, toe touch only, then a 3-point gait pattern must be utilized where the walking aid makes contact with the ground before the affected leg touches the floor. Then we also have the 4-point gait pattern. In this gait pattern, there are 2 walking aids used. So with 3 and 4-point gait pattern, you're going to have 2 walking aids or assistive devices, 1 for each leg. So the way this is going to work, it's going to be the right walking aid followed by the left leg, and then the left walking aid followed by the right leg. So what this constitutes, and eventually as you're trying to get back to a normal gait pattern, this is what you'll use with your patients. This is appropriate only when both legs are able to support part of the body weight. So you would not use this with a non-weight bearing patient, of course. So you want to use it with somebody who's a good portion, 50 to 75%, they're almost back to normal without using the assistive devices. So they can support a good amount of weight on both lower extremities. Subjects who have only minor stability problems, they may be able to use 2 canes. You just want to assess it, obviously, before you make your patient do this in the clinic. A 4-point gait pattern is ideal for balance because it provides the most stability and support through 4 different structures. And like I said, it's a step to relearning normal reciprocal gait pattern, which is ultimately what we're trying to get our patients to do, back to normal. So lastly, we're going to talk about factors that affect gait. So that includes age, gender, the assistive device they're using. Again, when we say assistive devices, we want them to be used in a positive light, but I can't tell you how many times I've seen assistive devices that are too low, they're too high, it's not the appropriate assistive device for the patient, so that can be affecting their gait pattern in a negative way, that we want to change it and make sure it's in a positive way. So I encourage you guys, if you're out in the clinic, you're on rotations now, make sure that you assess your patient's assistive devices. You will definitely make your CIs proud if you find something that needs to be tweaked just a little bit. Some other factors that can affect gait: muscle weakness or paralysis, asymmetries in the lower extremities, and any injuries or malalignment. So one leg's longer than the other, that's going to have a huge impact on their gait cycle. So that is all for tonight. Thank you for attending my session. I really look forward to being a part of PT Final Exam. Have a great night.